Hello,
So
everyone.
good.
My name is Angela Fullwood, and I'm the supervisor of parent and family engagement. And with me, I have my executive director. Her name is Dr. Felita Lewis. Dr. Lewis, you have to unmute.
I guess that would help, right?
Yes.
Good evening to everyone, and thank you all so for joining us tonight. And I certainly would like to thank our team of professionals from the Hillsborough County Public Schools for coming on to share your expertise with our family and community members tonight. And I am looking forward to learning as well myself.
All right. So tonight we're talking about child anxiety, which is really a great subject area for parents to learn about. And so with that, I'm going to turn it over to Dr. Maria Russ. Dr. Russ.
Thank you, Ms. Fullwood, and I'm so glad to join each and every one of you tonight. And certainly we're hoping that the information is very informative and that if you have any questions, please write them down, put them in the chat, and we'll be very happy to, answer those questions for you. So I am a certified pediatric nurse practitioner with a PhD in nursing. And certainly I am the supervisor of school health services. So we deal with a lot of anxiety, and especially around COVID-19. And I know that a lot of you parents are experiencing this at home. So we want to talk about generalized anxiety and when do you really need to worry, when do you really need to be concerned. And so as Ms. Fullwood was sharing a little bit earlier, it's normal for us to feel a little bit of nervousness, feel a little uneasy, because we're uncertain of whatever that outcome, if it's a new school, if there's change. A lot of our students were e-learning and now they're brick and mortar. They have new teachers. They may have gone, when they left, they were in 5th grade and now they went to 6th grade. So they went to a new school, or if they were in middle school, 8th grade, and now they're in 9th grade, now they're in a huge high school, right? So change a lot of times bring that anxiety, that feeling, that worry, that concern. So when do we as parents get worried about this? And when should you seek, your provider or help? Well, if you notice that anxiety is starting to interfere to the point that your child or teenager no longer wants to go to school, have a change in eating habits, they're no longer wanting to eat, or they're eating a lot, or they're having problems sleeping, they're having problems concentrating. It's important to always monitor those grades. So if they have different changes in grades, and a lot of these things aren't something that you can explain. If they are having outbursts or quickly getting angry, and so mind you, it can be confusing a little bit when it comes to teenagers, right? Because we also know they're going through hormonal changes, right? So but if notice that fact that this is starting to interfere with their life, interfere with going to school, interfering with their friendship. And we know that there's a lot of things that can cause that anxiety. We talked about changes in school, but we also know things like bullying, and other pressures, lots of pressures when they're in a baccalaureate programs or magnet programs or athletics. And I know that Dr. Hernandez is going to get more in details in her presentation about different things that you can watch for as a parent and what you can do to help with anxiety. So I'm going to talk about from a medical standpoint that it's really important to have that conversation with your provider. And so how we treat this and how we manage this, there's so many different great medications, SSRIs for antidepressants that are very effective in treating, and know that anxiety can be something very temporary. It doesn't necessarily mean that it's long term. So medications, it doesn't mean that it has to be a long term, but we know that we've seen great results within a week or 2 weeks after starting on medications. If your child has different side effects, that you're concerned about, please make sure that you talk that over with your healthcare provider, because there's so many different medications, and and sometimes it may not be the right medication for your child, but like I said, there's so many different other medications that are on the market. So um, so that being said, I'm going to now turn it over to Dr. Hernandez so she can talk about the different things that you can watch for, and that contribute to anxiety in children and adolescents.
Hi, good evening, everyone. My name is Dr. Yvonne Hernandez, and I am an assistant professor at USF College of Nursing. Um, and I wanted to share a little bit and talk about digital media. And really, under digital media, it's very big and broad, but we know about social media, whether it's TikTok, Instagram, as well as, not only TVs, but different series, and just the amount that children and adolescents are exposed to is the whole new world right now. So we know there's some pros, right, to have this interaction, to have this community virtually, but there are also some cons, right, and what is too much. And so I wanted to talk a little bit about, well, what can we do as parents to help and support our school age and adolescents? What are some overall kind of recommendations that we can consider? So I wanted to first share that it is important for you in your house as a family to discuss and kind of understand, what is your plan about digital media? Is it, what do you want to, what are some areas that you want to claim as free from digital media? We want to always also recommend the normal wellness health promotion. So for example, it's important to make sure that children and adolescents are getting the required sleep, right? Daily required sleep, as well as daily physical activity. And daily physical activity should be at least an hour, and adequate sleep really can range anywhere from 8 to 12 hours. So that's, want to make sure that that is happening, and digital media, whether it's social media and so forth, can interfere with that occurring. So those are things for us to consider with our children. Also some recommendations to in the bedroom, to avoid devices in the bedroom, to have time points when, if the devices are in the bedroom, that they're turned off, to have that communication and kind of set those boundaries for what works for your family, especially when we're doing homework. And again, identifying those times where you guys as a family unit can experience and enjoy each other without the presence of media, of the digital media. It's also important for us to communicate with our children about something called like citizenship, digital citizenship, and how to communicate and what is appropriate and what isn't appropriate. And that also brings into avoiding whether it's cyberbullying, and being aware and communicating with our children so that we have an understanding for the platforms that they're using. And the reason I kind of bring this up is that these are ways that we can help and support our children so that they're using digital media safely. It's with us, it's not going away. And we want to find, we want to strike that balance. We want to find that balance. And it's also important for parents to remember that, we're role models, and to help and support by setting these boundaries or what works for your family unit is critical. And then just bringing back the benefits, right? The benefits of sleep and physical activity for well-being, for mental well-being, for physical well-being. And that's kind of what I wanted to share. I know it's a little bit of some basic, but very important when we are discussing our current day with our influence of media in our children's lives that is ongoing.
Thank you, Dr. Hernandez. And again, she does research in this area a lot, with gaming. I know some of you know all about Fortnite and um, TikTok and all of these things that, and like you said about cyberbullying, all of those pieces, intensify or affect rather our children and adolescents are getting the proper amount of sleep, and so forth. So thank you, Dr. Hernandez, for that.
We
And
do have a
so as
question. We do have a couple questions.
okay, okay.
All right. Someone asked, have you seen an increase in child anxiety within the past year?
Absolutely. And also I'm going to let Miss Ann Townsend and Michael Kelleher, who's our supervisor of school psychology, as well as our supervisor of clinical care. They are going to speak more on this subject, but absolutely. And I'll tell you, it's intensified, because we have of course, some of our audience members probably had a personal family member that has passed away or become increasingly ill from COVID-19. And so a lot of people, especially our children and adolescents, they are concerned about that. And we have also instilled that we're concerned about them getting infected with different viruses and infections and so forth. And so that also brings a lot of anxiety, because our children and teenagers want to do exactly what we tell them to do. So, and we tell them how to protect themselves. Well, as we give those instructions, that in itself increase the anxiety that our children and teenagers may feel. So
Also,
yes.
there was a question about what age can anxiety of or any other disorder be diagnosed? How young?
So anxiety can start very early. You have everything that starts from separation anxiety, right? How many of you have taken your little ones to daycare or school for the first time, and oh my gosh, they hold on to your leg for dear life. I'll never forget, this is sad, and so don't judge me, but my neighbor and our children were the same age, and we were taking them to daycare. And my son was just like, bye, mom, and just left, and her daughter was hanging on for dear life and didn't want her to leave. And I'm like, why can't my child be like that? So anyway, so very early on. And this has a lot to do with, moves, sometimes with like military, unfortunately they have to move, with their orders. And so those different changes, right? Because what does that look like as an infant, as a toddler, as a child? And those things can affect, rather, sometimes people end up having anxiety disorders, meaning like if you're moving constantly, and you don't know what to expect down the road. That's why what Dr. Hernandez said is extremely important, meaning communicating with your child or teenager is important, letting them know what's to come. It can be something, even divorce, separation or arguing, yelling, any of the fighting, any of those type of things can cause anxiety in our children and adolescents, and in us as well. With a lot of job instability, right? We've gone through a lot of that, especially with COVID, with businesses closing and hours being cut, and we have increase in homelessness. So all those things impact, if we're worried about how we're going to pay our bills and how our children are going to eat dinner or breakfast or lunch. I mean, all of that produce anxiety. And our children and teenagers are very close to us, right? They pick up when those uncertainties or anxiety exist in our household or in their household. So yes, that's an excellent question. And you're absolutely right. It starts very early on, even in infancy. Go ahead.
I
I'm
have one
sorry.
more. It says, I have a kindergartner. She has epilepsy and takes Keppra. We
Mhm.
noticed some changes in behavior when she started in the Keppra. She became more emotional, easier. Since the start of the school year, her emotional behaviors have become more frequent, interfering with school. She gets upset really easily and has a hard time recovering. She does not get angry, but gets extremely upset. She has started falling behind academically, and we've noticed a change in her sleeping pattern. She can't stay asleep for longer than an hour without waking up, rolling around, sitting up. She has had a hard time remembering students' names, and then she gets upset when we ask her about her day at school and she can't remember what she did that day. We have started OT and ST to help with her schooling, but I do not know if we should seek out a child psychologist.
So there's multiple things that may be going on because you shared that this child has a seizure disorder. So from a neurologic standpoint, Keppra is a very good drug with managing seizures. But first of all, I would want to know when was the last time that EEG, a sleep deprived EEG, was done on the child. When was the last time the medication was changed? And has the medication been effective? You know, like when you did your lab blood levels, so there's a lot to unpack there. Not to say that it's not anxiety, because it'd also be interesting to know that was she at school before this, she was in kindergarten, right? That was she in kindergarten? She said, did she start kindergarten, or did she say the grade?
Yes, the child is in kindergarten.
Okay, so this is her first year in school, or was she in daycare or pre-K before? So if this is a new time to school versus she's been in school before. So, that's always that comfort too, where the child has been with us forever, been with us for 5 years, and now we're introducing them into a new environment. So, so also speaking with the teachers, finding out what's going on, does she have friends in the class? Is she having seizures? Has she had a seizure? When was her last seizure? So all those things will come into play. But certainly, I would, collect as much information so that when you go back to your provider, that you have that information to be able to share. So yes, but if you're doing all the things, like keeping a routine, getting her to bed early. Now the problem sometimes is if we put them to bed too early, then you can have that problem. Or are they taking naps at school? I know that a lot of times naps have been cut out. But although, without knowing all the different pieces to that puzzle, and at the end of the day, when you go to your child's provider, at the end of the day, they may refer to a child psychologist or a psychiatrist. So I would definitely try to take as much information, especially if this is a change. The child was one way and now they're different. But I also am concerned about what type of seizures, because if she's forgetting, that can also be a seizure, especially if she's having little mini ones, and to the point that teachers may not be recognizing that she's having a seizure. So also not knowing the type of seizure. So if the person want to put in more about the type of seizures that her child have, because if she doesn't have grand mal seizures where she's on the floor, and that she's just doing blank stares and so forth, the teacher may not be picking up that she's having a seizure activity, as with the parents may not either, because they may not realize that she's having that seizure. So having that seizure log is important and critical.
That's very good. Thank you for that, Dr. Russ.
Mhm.
We have,
Thank you.
I have another question before you move to your next panelist.
Okay.
They're asking, how can a parent help? How can a parent help our child when the parent also suffers from anxiety/depression?
Well, we have two dynamic psychologists on, and Dr. Hernandez may also want to address after our two awesome psychologists. But I also say those same things, other things too. Coffee drinks and caffeinated beverages are big things, right? We love those. So all of those too can make you have that same feelings of nervousness, anxiety, and so forth. So while it may be soothing and socially great, especially for adults, I mean, those are things that can make us feel, a little more anxious than, and as an adult, if we're a worrier, then there may be a tendency for your child or teenager to be a worrier. So, so you're doing the same thing, like Dr. Hernandez is saying is, as a fit, you and your child maybe go for walks, maybe going to exercise, going to gyms, or different activities, so any in all different types of uh, activities, family activities, or especially physical activities are really good ways of reducing anxiety and helping with some of that anxiety and coping, getting positive and good coping skills, which again, I'm going to defer to the psychologists as they do their presentation more. But I also, as we move into our psychologists, supervisors, I want to talk about the fact that I'm a strong believer, and as well with most providers, that medication itself is not, I believe that you really should have counseling. So medication does its part, but counseling is extremely important. And then also speaking with your provider, there's different things like cognitive behavior therapy. So there's all type of things that we can refer you to specialists for as well. So that being said, now I'm going to turn it over to Miss Ann Townsend, who's the supervisor of psychology, and she will, I'm sure, have more to share on this topic.
Good evening, everyone. Dr. Russ, thank you so much for having us and setting this on. Again, Ms. Fullwood, much appreciated. This gives us an opportunity to reach out and connect directly with parents. And I've been looking at the chat box as well. So I think what I'll do, if you all don't mind, is I'm going to step back a moment and I'm going to say that sometimes anxiety is actually a good thing. It's our body's healthy way of recognizing a situation that may not be familiar or maybe is somewhat uncomfortable. It's whether or not you adjust to that anxiety in a very healthy way, and it's not sustained over a period of time. It's when we start to get concerned when that is not the case. So being a little anxious about something new, something foreign, something different, it's natural. It is natural. But we want to make sure that in no way does it impede our children, our adolescents, our teens, or even us as adults from functioning effectively. So it is my pleasure to be part of this panel and to talk a little bit about student services, and in particular, the various groups that can partner with you all as parents, as well as partner with private practitioners when it comes to supporting your children. So every school has a student services team, and that student services team consists of members such as school nurses, school psychologists, school counselors, formerly known as guidance counselors, school social workers. We work in tandem with parents and private practitioners with parental consent in order to support students. So I was reading a little bit and hearing a little bit about the comments regarding the kindergartner with epilepsy and taking Keppra. I would highly recommend that that parent seek out a member of the student services team at the school, consider signing a release of information, and partnering with your student services personnel in supporting the child at the school setting, just as we would in the home setting or the community. So there may be certain observations that can be done, conversations that can be held, and other supports provided within the school setting and shared with the private practitioner. So if there are behaviors that are observed that are of concern, that medical professional or private psychologist can work hand in hand with you all as parents and with school personnel in supporting the child there. I'm also going to share too that we talked a little bit about counseling very briefly. Counseling is great. I often suggest to parents that counseling can be done individually for their child, but also look at family counseling. The family is a unit. We support each other, we care for each other, we love each other. And there are times when an individual who has anxiety will internalize things. It's all me. I'm doing something wrong. I'm not doing something in a perfectionistic way. What is it that I'm doing that doesn't allow me to socialize the way maybe my peer socializes with others? And I do think it's very important that that child see that as a family unit, we all support each other. So while there may be individual sessions with a private practitioner, consider also having family sessions, because then it shows not only that child that they're important, but they're a member of the unit, and the unit works together to support and love each other. I think that's incredibly important when working with children. When we start looking at what can we do as parents, Dr. Hernandez mentioned we are role models. Absolutely, positively, yes. But also take that opportunity to role play. So having conversations with our child or children early is key. We need to start talking and making our kids feel comfortable seeking out trusted adults. Trusted adult will be you as a mother or father. Trusted adults will be those at the school setting that the child can confide in. And I think what's even more important than that is giving that child an opportunity to share or express what is it they're anxious about. They may be able to do it in words. They may be able to do it in pictures and not be able to share it in words. But we need to listen and hear what they're telling us they're concerned about. And I think being able to role play is going to be key. So if a child tells you that they're concerned about a social situation, then I think having that opportunity to practice with that child, what's the worst possible thing that could happen? What's the worst possible scenario that could happen? Have that discussion and then role play. Put the child in one position, put yourself in the position of the child and practice using language, practice using body language, just not spoken language, so that we're empowering children and predicting what can possibly happen. And it may not be as bad as they have imagined. So I don't want to speak too much or too long. I do want to give some time as well to Mr. Michael Kelleher, who's the supervisor of clinical care, and we'll continue to monitor the chat box. But I did want to kind of lay that foundation that anxiety can be good. It's how much anxiety and how we respond to it that we need to monitor.
Okay, so I do have a good question here. Some lots of good questions coming through. One of the family members asked, is there a connection between ADHD and anxiety in a child? My son is extremely ADHD, and how do I determine signs of anxiety versus the ADHD?
And I'm not sure, I don't know what Dr. Russ, did you want to take that one? You're muted, Dr. Russ.
I'm sorry, Miss Townsend, I was letting you finish, and then I was going to go after you, so do you want to take, or you want me? Go ahead.
Go ahead and take it. I'll chime in if need be.
Okay, all right. So yes, so all of this is part of the whole family, right? So yes, anxiety, generalized anxiety, and depression, all of those can be related. Doesn't mean necessarily that it is, but yes, there is a high likelihood of anxiety, depression, ADHD. So it just depends on the symptoms, right? So we have to look at it and what age that these symptoms start, so that gives us more of a clue of, is this related or not? So, and you can transition. So remember, I said, when we're talking about anxiety, and as Miss Townsend spoke so eloquently, is that a little bit of anxiety is normal and natural, right? Because it helps us do our very best, right? And it helps us get up and get moving and start our day and end our day and be productive. It's when that anxiety starts interfering with our life, right? It makes us not want to get up. We can't get up. We can't go to school. We can't go to work, where we start saying, okay, when it starts interfering with our daily life activities. So that's when we start looking into more of that. And then, yes, that's when you can look at the fact that maybe there are some components from ADHD, depending on, attention, concentration, right? So so yes, there can be, the answer to that is yes, there can be an overlap, but there are good ways to try to discern if it's ADHD or just, or I don't want to say just anxiety, because anxiety is a very real issue, or concern for people that are experiencing that.
All
Do you
right.
want to add anything to that, Ms. Townsend?
All right, we have another question. Do you have any information about partial hospital group therapy for a teen experiencing anxiety due to school. My daughter's having school-related anxiety and is missing a lot of days. She is on Zoloft that was just started and has been on it for 10 days and seems to be working better than the Lexapro. I'm not good with that. My sister's a pharmacist, not me. Okay, so the program offers 6-hour therapy during the day, but she will have to do virtual school.
So I love both Zoloft and Prozac, for teens, and stuff, especially low doses, they usually do very well. And like she said, she's already saw results in a very short time. Nothing against Lexapro. I mean, it depends on what we're treating. Depending on, and the great thing is that in most practices now they do a checklist, right, to try to identify what's going on and to be able to address that. Virtual school, of school avoidance. I mean, to me, again, you need to try to figure out and have that conversation, because is it something that's happening at school? Is there bullying? Is there, why are we doing the school avoidance and going to virtual? So it really again, that's why I think counseling is amazing, and not just because the medication is helping with that part of it, right? And now the counseling piece can help us to try to overcome whatever we're having that anxiety about, right? And helping us to move forward so that we can engage and have a normal, regular life. So, again, I'm reluctant because I'm not that person's provider, and so I certainly wouldn't want to say that what they're recommending is not the right choice or right decision. However, disengaging and decreasing socialization tend to, depending on what that anxiety is, not tend to be as helpful. But again, without knowing the whole picture, it's really hard to say. Please, panelists, jump in if you want to add anything to what I just shared.
So speaking of therapy, we have a question about that. How do you get a child to actually participate in talk therapy versus just sitting there and not wanting to engage? That's since you're encouraging therapy.
So this is fantastic because this feeds right into our next supervisor of clinical care, Mr. Michael Kelleher. So Michael, you want to take it away?
Sure. Thank you, Dr. Russ. My name is Michael Kelleher, Supervisor of Clinical Care. So I help to oversee our mental health plan for the district. One of the main focuses of my job is working with our contracted mental health providers, our community-based providers. So helping to be the liaison between our students and families and the mental health providers in our community. I just want to say a few things before I get into that. I see that we have parents from elementary, middle, and high school on the call, which is great. So anxiety is one of the most common types of mental health disorders. Okay, so you're not alone. Your child's not alone in this. It's very, very common. It's actually the age of onset for anxiety is quite young, elementary school, but the onset can be any time throughout the adolescence also. So it's not uncommon in middle school or high school. That's why we always say be noticing those signs and symptoms of any type of change in behavior. We're talking about ADHD, anxiety, possibly depression. I always tell parents, don't worry about diagnosing it. Okay, really don't worry about that. Let one of the professionals do that. Just notice any of those changes in behavior. Be mindful of that. Dr. Russ very well said, notice those changes that are maybe more frequent, they're happening more often, happening for longer periods of time, all right? And more intense. So that impact on their daily life is there. That's when you should seek out help. Okay, when you're just noticing that those changes are very much impacting your life. Your school is there to help. If you don't know what to do, there's a lot of great questions, go to your school. Like Ms. Townsend said, we have great student services teams that can guide you in the right direction, that can talk about that individual circumstance, that know your child, can get to know your child, and make great recommendations, whether it be school-based services by the great teams there, or we have wonderful contracted providers. You may know some of them: Grace Point, Chrysalis, Northside, Success for Kids and Families, all these, the Crisis Center of Tampa Bay. We've contracted with all these providers to help provide services to families. There was a question if we've seen more anxiety this year. We've seen from my end more referrals for mental health services this year than we've seen over the past 3 years that I've done this position, by a lot so far this school year. Anxiety tends to be at the top of the list for the reason behind that. The nice thing about it, though, is that we do have more support than ever, I feel, at the school level and in our communities that are ready for this. So it's really just finding the right individual or professional for your child, for the family, like Ms. Townsend said, because that's important, that wraparound piece, finding somebody that can work with you, your child, the school, just wrapping around, because it absolutely can get better. If you are having trouble finding a provider, if it's too long of a wait, we've heard that, you know, it's months and months and months to even get to see a provider in the community, to see a therapist, to see a psychiatrist. Go to your school and ask for help. We have a mental health plan where many times in a much more timely manner, we can help out with those things. So again, we really emphasize that. Please be comfortable going to your school, asking for the school social worker, asking for the counselor, asking for the school psychologist. We actually, this school year, we have therapists that are working on campuses in many of our schools just to support and supplement the services already there. We have over 100 schools with these services. So I see many of the schools on here, we do have that at the school. So that could even be a possibility. So again, just getting comfortable with the school, I think, is very, very important. And I'm going to kind of stop there and just wait to see if we have any questions.
Yes, there are several questions in here. We have lots of questions. So let me get you started. How can a parent help? Okay, no, I did that one. All right. So how do, sorry.
Well, while you're looking at the questions, I do want to add one more piece.
Okay.
Is that it's important because I noticed the parent said that, you know, her child was starting to feel better on the Zoloft. So this is a critical moment, because oftentimes what parents will do is then take their child off medication. So it's really important to keep your child on the medication, taking the medication regularly, not skipping weekends, not skipping dosages, because those levels get to a certain level in the bloodstream to keep them feeling, you know, the way, you know, in a good place, you know. So having it drop down when they're not is what happens if, and then also providers are making decisions on increasing or decreasing the dosages based on their blood levels. So it's really important that, you know, that your child continues to take their medication regularly. You should see improvement within the first week or two. And so you want to make sure that they're taking their medication as prescribed.
All right, so it says my daughter's teacher was changed almost a week now, and she's been having nightmares. Would this be anxiety related?
Okay, I'm sorry, I was waiting for one of the psychologists to talk to speak on this or whatever, because you know they deal with this on a regular basis, and as well as their staff. So absolutely, it can absolutely be anxiety related, you know, and causing anxiety, because change, right, causes that anxiety, and then not knowing if they're going to have a different teacher, you know, from 1 week to the next, if they're going to have a different one. So all those uncertainty types of things can make us feel uneasy and worried. But what we could do as parents is reassure, right? And so they know that I'm dropping you off and I'm picking you up, and so every time I'm taking you to school and at the same time I'm picking you up. So that will build the child's confidence, decrease the anxiety. And as the year goes on and there's not another change in terms of teachers, and even if that change happens, having that conversation with the child. And then also having a conversation with the school, because some children are slow to warm, some are slow to change. And so if you know that your child has difficulty with change, it would be great to talk to the principal and the teacher so that if there's a change that's coming, they can start to prepare their child for that change.
Okay, thank you for that. Next question is, I have a 9-year-old son in 4th grade. When he gets frustrated with homework, he cries and or hits himself in the head with his hand. How can I help him work through homework frustration in a better way? He is not on medication.
I'll go ahead and step into this one. So I think the key here is we're looking at a 9-year-old and we're looking at a 4th grader, and that's atypical behavior, right? In some respects, anxiety can be linked to perfectionism, right? If we don't get things just right, it can create anxiety. So part of it is I would highly recommend chunking some of those homework assignments so that he's not overwhelmed with so much at one point in time. So it might mean after school, taking a little break, running around, engaging in some exercise, something healthy, and then maybe having a snack, having dinner, or maybe not sitting for a period of time consistently and working on homework. It might be something that needs to be broken up into smaller segments, as well as presenting information. I've seen students who get a page of mathematical problems and it's just too much. It's just too many equations. Fold that paper in half. Use another piece of paper to cover and just present row by row or column by column. Breaking it off into manageable chunks will in many ways alleviate some of that stress. I am concerned that he's engaging in some behavior that would be considered maybe self-injurious. If he's hitting himself, I'm concerned about how are other ways that he can express his frustration. So beauty of a 4th grader is you can probably have some conversations and encourage him to use his words to express how he feels. And then there are other outlets that he can use. We talked about some kids do well with language. Some kids need to express their frustration in different ways. So if they need to build, if they need to draw, they need to mold, play, and create, allow them to do so. Sometimes they're able to get their frustrations out that way. Um, I see you say he's not on medication, and again, medical items I'm going to defer to Dr. Russ, but we heard a little bit earlier in the presentation how it's important not to see at any point in time that medication alone, a pharmacological intervention alone, is never 100% advisable when we're looking at anxiety. So we're looking at attaching that emotional building and support with what may be in time considered to be appropriate for medication. And I defer to your pediatrician, your pediatric neurologist, psychiatrist, or whomever, but pairing that up with some emotional support as well. Part of the anxiety comes into play when we don't know what we're supposed to do. And equipping folks, equipping our kids, our students, our adolescents in advance with healthy ways in which they can respond to those anxiety-provoking situations, I think will be helpful. And give it time. It's going to take time.
All right, I do have another. I have lots of questions in here, and I want to kind of pull these in together because they're very similar. I'm going to just do the scenarios of the questions that are kind of the same. It says, my 3rd grader doesn't make eye contact when talking to some for the first time, fights a lot. What can I do to help? Is this considered social anxiety? And then it says, my 10-year-old boy worries a lot, getting late for school, not flexible with schedule, cries if any little change in schedule during the day. He's an A student in academics. Is he having anxiety? Do we need to do anything? And then it says, my teen has Tourette's, severe anxiety. He gets himself worked up and schoolwork and thinks negatively about himself when it comes to that. Any thoughts? So kind of all of these are like trying to figure out, are these because one of the questions down there is they want to hear more elaboration about keys to note the signs, if it's true anxiety or just fluster. So could one of you all speak on that?
So I think all the things that you just said are signs, they're behavioral signs that something is not right, right? So it's hard to say exactly just from reading the scenarios, whether it's anxiety or something else. But like I said, I would note those things. And if they're interfering, if the grades are being affected, if they're not wanting to go to school, not wanting to participate with things that they used to, some of those things we said could be normal in a young child growing up. They may not want, to go and look somebody in the eye if they don't know them the first time. That could be very much normal and not an anxiety disorder type of thing. But if it's happening so much that they're, scared to come to a new group all the time, perhaps scared in school to initiate tasks and things like that. So you see, again, what I talked about earlier, the frequency and the duration are more intensive. That's when you should probably seek help. And a great place, like Maria said, is starting maybe with even your primary care doctor. Collecting a little data for yourself. It doesn't have to be intense data, but just going to your doctor and say, here are the things I've noticed, and here's exactly what has happened. And see if you can kind of get a recommendation from that. And then another avenue is the school. Meet with the counselor at the school, the school social worker, the school psychologist, and say exactly how you're feeling and telling them what you're looking for in their experience, and the school nurse, how to look for those things at school, and talk with the teachers to see if it's happening in the classroom, so that we have a well-rounded picture of that student and your child, so that we can hopefully hook them up with the best services. And again, there's a lot of services out there. I saw many questions, Ms. Fullwood, in there about timing of getting services, the amount of it's costing and things like that. Those are ideal issues to please talk to your school about, because we do have avenues to support that. Please, you can send me an email. My name is there, Michael Kelleher, michael.kelleher@hcps.net. And we can kind of help walk you through that. We have some district mental health clinicians that are assigned to each school to help support the schools and families and students. So please, and thank you. Someone put the emails of all of us in there, so we're there to support.
Participants, you can take a picture of the screen if you'd like, and all of our emails are our first and last name, as you see them there, our first dot last name and it's Hillsborough County Public Schools, but it's the letter hcps.net. But someone put it in the chat so you can have it.
Ms. Fullwood, I'd like to share too, because I do see a lot where they're asking about strategies and what do we do? How can we help our child? I put a link in the chat box from the National Association of School Psychologists.
Awesome.
It's a great resource for parents to provide a little bit more information about childhood anxiety disorders and signs and symptoms, as well as possible interventions and supports.
Okay, and I did see one of the a question about shared a child who shares household, and I really wanted to ask that question because I know sometimes those situations. Let me go back to it. Okay, do you have any tips or suggestions on how to prevent anxiety for a 6-year-old who lives at 2 households? There's a lot of that happening now. My 6-year-old stepdaughter spends half her week with her dad and it spends the other half of the week with her mom. We have had issues lately with the daughter not listening and not doing her work. Everything is an argument, and trying to get simple tasks done can be a struggle. Is this inability to focus maybe linked to some sort of anxiety? And is there anything that we can do to help?
So yeah, so there's a lot of things that you can do. First of all, have an agreement between the different households, having a consistent bedtime, meal time, homework, so having a consistent schedule regardless of which home the child is staying at is critical, because again, when we've introduced change, and so whenever you have change, then it produces anxiety. And so again, being consistent is, especially at that age, is critical. And then having conversations, a lot of times we tend to talk over, talk around, talk about, and the children, they're listening, as well as the teenagers. So again, including them as much as possible in conversations and in those the changes that will be happening to them is critical. And so, and then trying to, as much as possible, marry those parenting styles, because that's where it can be very critical. Whereas one household, it's not a big deal, they are more lenient, and then they go to a different household, and then that's like, oh, it's strict cutoff, so, and so forth. So again, establishing the same rules, and sharing those same rules, and especially if they could be married with the rules in school, then you get more consistency, and then also positive rewards. We are very good at punitive type of things, right? But giving rewards and establishing a reward system at both households that, again, look very similar. I do want to add one other thing, is because sometimes you can also have these issues with language, not that this person brought that into the fold. And so what I recommend in those type of situations is that when you have one household that speaks English and one household that speaks Spanish, that's fantastic. Bilingual is great, for children as they grow up and develop. And we found many research studies that support that. So, so that's how I would handle those, that type of situation. I don't know if the other panelists want to add something more.
I do have a couple questions in here that are specific to school counselors. I guess at Hillsborough County Public School, it says, my daughter was having anxiety and I asked the school counselor to talk to her. She called her down and talked to the school counselor, but it made her anxiety worse. She was so upset about it, and now she refuses to talk to anybody. Refuses to talk to anybody but us. I've been trying to help her. It's getting better, but what if your child refuses to talk to the counselor? Do you all force it? How does that work?
Michael, you want to take that one? With the clinicians.
Ann was going to jump in there, I think.
Oh, they're great, fantastic. I'm sorry, Ann.
No, I defer to Michael. The beauty in all of this is everybody is here so willing to help and share their knowledge. So yeah.
We always want our child to feel comfortable with somebody. It's not going to work if they don't. If they're not going to want to talk with a person, then you can't force them to talk. Okay, so I really think that just finding the right trusted adult, and not every trusted adult obviously in the school can provide counseling, but having an important trusted adult at the school is so important, so that your son or daughter has somebody they can go to at any time and let them know that they're having a concern or a problem or what they need. I would say, even as the parent, get to know the counselor or the social worker or the school psychologist yourself. Try to build a relationship with that person, and then kind of wrap your child into that, if you will, so that they see that you get along well, that you're comfortable, because obviously your child's comfortable with you, they're talking with you. That may help. That may help a lot. And then just reinforcing with your child that you're there for them, that there's other people at the school there to help them. So it doesn't appear that you're forcing it on them, because that could create a barrier or a roadblock with that relationship. So just be as supportive as you can. Model being with that person, those professionals at the school, and how you interact with them, and just trying to maybe do it that way, so that slowly but surely your child maybe develops a relationship with that person.
Thank you. And there's like sometimes a slippery slope, because this is a great question from one of our attendees. How do you determine when to encourage your child to be brave or when to step back and listen to your child's anxiety? How do you know when to teeter between those two things? And
So I think what we don't want is for a child to put himself or herself or themselves in harm's way. That's going to be number one, right? So we talked about anxiety can sometimes be a good thing because it does protect you in uncomfortable, awkward situations. It's your body's response to things that are that don't feel quite right. I do feel that again, I keep going back to communication, having those conversations with trusted adults. I think it's important to maybe get to the root, if possible, of where those social or peer difficulties may be occurring. And again, try to empower and equip not only the child, but making other adults that are supervising the child in various situations, whether it's um, uh, athletic, extracurricular athletic or sports teams that they participate on, whether it's in a classroom, whether it's in maybe less structured activities on the playground during school. But I think being aware and having those conversations with adults so that they speak, that they have their eyes on the child, but also speak to the child. It's that fine line between not having that individual student who's anxious feel like it's all about him, versus also looking at the situation of seeing the environment that can foster that support and that sense of well-being and security. And I think that's the key. Kids have to feel safe, just like as adults, we want to feel safe in our environment.
all right, thank you. Thank you for that. Did have a quick question. Do any of you all know who can make their dog, their personal dog, an emotional therapy animal for their son? They asked the doctor and they didn't know. So do any of you have any resources that you can send this question to answer this question? No.
So there is a difference between an emotional support dog and a service animal that's been trained to provide a service. What I can suggest, if you'd like to send an email, I can send an email, or I can possibly put something in the chat box as far as the link. But there really is a significant difference between an emotional support animal and a service animal. So it depends on what the ultimate goal is in terms of having the animal.
All right. And I think I'm going to let this be the last one because we are running out of time. It says my 14-year-old daughter did not come from a feeder school, so knew no one going into high school. Smart, funny, kind, but no one at the school would know that because she is so shy and doesn't know how to be herself at school. She tries to make herself invisible. How can we work to build her self-confidence and actually make friends?
Well, I know that she's 14, right? So it'll be high school. There's many activities and clubs and things at high schools for just this part of thing, this socialization, this positive kind of social environment. So I would encourage her to kind of explore the different activities that the school offers, whether it's during the school day or clubs perhaps after school, to see what her interests are. And whatever her interest is, she can find a niche and a group that is also interested in that. That's how maybe she can start building on those relationships at the school, starting small with a group of friends, perhaps with a similar interest in like a club. So it's a positive, pro-social type of group that's maybe school sponsored. And then from that, of course, things will grow probably pretty quickly. So maybe just getting with her, seeing what her interests are, and then asking the school where she could find those interests in others who are interested in the same types of things.
All right, thank you so much for that, Michael. So Ms. Hernandez put some wellness activities in the chat if you want to go back and get those. You have everyone's email address so that you can reach out to them if you have any additional questions, or we weren't able to ask your question live in this session. But please, parents, know that our team of professionals are here for you. Would you all just give just some last words of encouragement, and we'll start with you, Dr. Russ, and then we'll go down the line. So any last words in closing?
So yes, again, thank you, and thank you for having us in your homes tonight. What I want to share is, first of all, deep breathing is an amazing thing. You know, I love the whole mindfulness exercise and activities that we're getting to, just meditating, taking a deep breath, just slowing down, because we're always on the go, 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 right? And that in itself produces anxiety for the both of us. But the other major piece is, I want you to know that you're not alone, you know, and some of the things that you're experiencing, as Michael said earlier, is very normal. And because anxiety is the most common, you know, problem that we all share together. And then my last in closing, I want to say is that no, as Ms. Townsend and Ms. Fernandez said, you know, you have a team at each one of your schools. And so there is a trusted adult. There is someone that you can connect with. And so if counseling didn't go well with one person, don't shut it down. Try with another person, especially a person that's a part of our student health services team. Thank you.
Professor Hernandez?
Hi, thank you. I just want to reiterate the importance of our wellness, of really striking a balance with all the things that we're doing right now, especially if you're doing something remote at the same time as taking care of your children. There's been so much multitasking and so many things happening, I think, at faster levels, that we need to take a deep breath, give ourselves a break, focus on making sure that we're getting our basic needs met, so that not only everyone in the family, but also the parents have, I think, the ability to be able to identify when there's things happening that need more outreach. And also because we are role models, and we want our children to have the best. So we want to also worry about taking care of ourselves. So I think that that's important, and making sure the basics is done, enjoying our time together. And that's all I wanted to leave, is just making sure that we listen to ourselves, our families, our kids, and take care of ourselves, I think is very critical.
Thank you. And Dr. Townsend?
Well, I'm still that dissertation short, Ms. Fullwood, but for that elevation. But I will say this, I completely concur with what's been shared by colleagues here on the call this evening. I will say that the parents who are on the line today, and maybe even some students on this virtual call today, hats off to each and every one of you. The fact that you've taken some time to reach out and to see what resources, what can be done to support my child or support me as a student within the district or an individual within this county, hats off, kudos. We are here to help. We enjoy helping. For many of us, it's not just a profession, it's a passion. It's what we love to do. In leaving, I want to share that I did put in a link for the Crisis Center of Tampa Bay resource guide. There's a fabulous online resource guide where there are drop downs where you can pick various topics in which you can receive information about local agencies and providers. So please do take a look at it. It's not just for those that are in immediate crisis. There are also wonderful links in there to support folks so we can prevent crises among adults and among children. Have a good evening, everyone.
All right. With that, we want to thank everyone. Thank you,
Can I do a word of wisdom?
Yes. Michael,
Okay.
yes, go ahead.
Oh, that's okay. So I'll be very short. The old cliche, we're all in this together, meaning that this is a community, and all the 60, we had about 90 some people at one point. So the parents on here, like Ms. Townsend said, it's so important. This is a support system. We need you just as much as the school is there. You know, we need the parents. It's that wraparound I said earlier that's so important, that we have you, we have the school, we're a community and a sports support system together to raise these children and young adults to be productive and happy individuals. We're here for you and we're excited to work with you. Have a great night.
Thank you so much. And we're here for you too. So if there are any other subject areas, families that you want to hear, type it in the chat, let us know. And I think it is going to be worthy to bringing you all back at another time, because we had so many questions and we could not get to all of them. And I'm pretty sure you all have just a wealth of information, but you all will be receiving a follow-up email. And if you didn't get an opportunity to catch everyone's email, I will forward the email. So you'll have my email automatically, and I'll forward the email to the to this fantastic, awesome group of professionals. So with that, thank you again, everyone, so much. And you all have a great evening. Good night.